Good morning. My name is Danielle and I'm here with the latest update on diabetes awareness in Indigenous populations. Group X's project concerns diabetes prevalence in Indigenous populations. Diabetes is a chronic illness that affects the body's ability to either produce insulin or its ability to use it. This disease, specifically type 2 diabetes, is disproportionately represented in these populations, which makes it a problem of utmost concern as chronic illnesses are now increasingly replacing infectious diseases, like polio, as leading causes of death. The goal with this project was to increase diabetes prevention and management techniques throughout the Indigenous communities, as well as providing resources throughout the communities. In doing this, the main focus of their plan was to bridge the gap between traditional practices and modern treatments to offer culturally comprehensive care. Now, I will hand it over to Deanna, who will discuss networking.
Thank you, Danielle. Now, in terms of networking, in order to gain knowledge about the communities they were working with, they connected with multiple professionals in the field. Amanda Lipinski was their first contact and a program director at the Indigenous Diabetes Health Circle. Throughout their meetings, they were able to gain key knowledge about the disadvantages of modern treatments and how focusing on decolonization efforts would be important for Indigenous communities to achieve optimal health. Now I will hand it over to Parmis to discuss the planning process.
Thank you, Diana. So, as a key portion of the planning process was to make sure that they made realistic strides as a group in order to achieve their overall goal. As per the SMART guidelines, their planning process was as follows. Their specific goal was diabetes health awareness in Indigenous populations, both including prevention and management techniques. In order to collect quantitative measure for impact, number of participants in their programs and social media campaigns will be analyzed. As well, follow-up with community members will help to gauge efficacy of programs. For results to be realistic and attainable, they put an emphasis on implementing traditional, holistic approaches toward treatment, management, and prevention. For realistic outreach, involving community members in decision-making allows them to make competent, realistic decisions that calls on the experiential knowledge of elders in communities. To achieve their intended goals, they have set a deadline for December 2019. I will now hand it over to Alexa to discuss their operations.
Thank you, Parmis. So, to implement their goals, a number of programs and practices will be used. To encourage lifestyle changes, cooking classes and physical activity programs are put into place. In addressing the diabetes crisis in Indigenous populations, it is important to encourage a shift in eating habits from unhealthy, high-calorie junk foods to balanced meals that traditional diets favored. As well, exercise is important to observe the best results for diabetes prevention. For awareness, a social media campaign was put into use during which sponsored ads for their programs and practices were introduced on several social media sites. A Canadian celebrity advocate, Cree Summers, who was well known for starring in a popular 90s TV show A Different World, was also used in order to gain a maximum outreach for their programs. Having grown up on a reserve, Ms. Summers has a very specific and personal understanding of this crisis and how it can be addressed. In addition, support groups will be held in order to offer a safe space for open discussion regarding decolonization efforts, healthy lifestyle practices, transitions to more traditional ways, and so on. I will now hand it over to Layla and Jerusha to discuss evaluation processes.
Thank you, Alexis. So, Group X inspected each phase of the planning process in order to guarantee maximum efficacy of their proposed programs. Group X's inspiration behind their process was to achieve a self-sufficiency in Indigenous populations and provision of accessible care that is culturally competent. Decolonization efforts are constant throughout these communities, and a unique approach to diabetes management and prevention techniques has to be applied to see results, which is their ultimate goal.
Resources used to gather the information necessary included health organizations like the IDHC that have worked extensively with Canadian Indigenous populations. Surveys and personal consultations with community leaders and elders were also important in order to personalize the approach. These organizations, along with university professors and healthcare professionals, also functioned as their contacts within the community and towards outside organizations.
Community involvement is also a big part of their program. So by involving important community-appointed leaders and elders, they can put relevant experiential knowledge to use to develop comprehensive solutions that address a number of issues within the community. This also helps to boost morale and increases self-sufficiency so that their own voices are heard throughout the community.
Their ongoing goals include helping elders to transition developed lifestyle habits into healthier choices and providing the skills and resources with which they need to make these changes. Implementation of traditional diets and practices and modern prevention techniques is important to offer methods that are effective. To create a lasting impact, Group X aims to include their teachings and program recommendations into the curriculum so that children can develop these skills and knowledge from a very early age.
Lastly, they have a number of ways to gauge success of the programs. The number of community members attending support groups and cooking classes is one way that they will do this. Continual funding in order to maintain these programs is another way, as it also raises awareness throughout the general public. However, their long-term goal and major success indicator will be for the diabetes rates to lower in Indigenous populations. Now, back to Deanna.
The efficacy of their program lies in the ability for themselves to be sustained without continued interference. Group X's social media campaign is a program that caters to the interest of the youth of Indigenous communities, and it has no set end date. Because of its online interface, it is available to everyone and can be sustained with little supervision. As well, through their partnerships with community leaders and elders, a strong relationship will be maintained and helps to keep their goals in sight. This also targets the distrust that Indigenous populations have towards non-Indigenous organizations by involving them directly in decision making. This encourages follow-up as well. Now, on to Jim with the weather forecast.